Hi, I'm Caitlin from Dash Physical Therapy, and we're here today to talk about foam rolling the piriformis and the TFL, which are some structures in the hip that we oftentimes miss when we're just foam rolling the lower part of the leg. This can be useful for someone who has runner's knee, IT band tendonitis, even people who are struggling with low back pain. So the biggest thing to remember is that there's no real right or wrong way to foam roll, as long as you're not going over any bony structures. So to catch the piriformis the most directly, the best way to do it is to start sitting on your bum, and you're going to cross the affected side over the other knee. That's going to put this muscle, your piriformis, on stretch. Then you can pop yourself just over a little bit so that you're really getting in there. From here, you're rolling back and forth. You can kind of keep it at a nice, easy cadence. You can find a spot that's painful and just try to stay there for a minute. It's hard. But you're unweighting yourself as much as you need to with this stance leg and your arms. So you're really trying to let the affected side be completely weightless. So you're really just rolling back and forth, trying to find those spots that are pretty tender and sore. If it's tender and sore, it's in the right spot. For the TFL, which is your tensor fascia latae, and it's on the side of your hip here, we're going to go onto your side. The thing that we want to stay away from is the bone of the hip and the bone of the pelvis here. So we want to stay away from those. So it's really about the size of your hand. You're going to come onto the side, and you're going to, again, unweight yourself with your top leg and your hand here so that you can make sure that you're not putting too much pressure. If it hurts too much, you can unweight yourself. And from here, you're really just going to be going back and forth. Sometimes you can turn from back to front, and you're just trying to find that tender spot. With this one, you're not going to be able to go very far because you can't roll over the bony structures. So just find that tender spot and play around with it. As I said, there's no real wrong way to foam roll, so if you find a tender spot, you're in the right spot. Thanks for listening.